Hey guys, welcome back to my channel. My name is Christine. I am glad you could make it here. So today's video is about types of depression. This is part 2 of the first video that I did. If you have not watched it yet, I am going to list the link in the description below. If this is the type of content that speaks to your heart, make sure you subscribe. And of course, sharing is caring. Make sure you share the link with your friends, with your family, with your colleagues. Yeah, and spread the gospel. So, the sixth types of depression is perinatal depression, and this is depression that happens to moms, to new moms. Perinatal depression can happen before you give birth, rather during the pregnancy or the first 4 weeks of giving birth. Mostly, or rather, most people refer to this type of depression as postpartum depression, but there is a difference. With perinatal depression, it can happen before you give birth or after you give birth. With postpartum, it happens after you give birth. Well, mostly, perinatal or rather postpartum depression is triggered by the hormonal changes that happen when a woman is pregnant and when she gives birth. Some symptoms of postpartum depression are sadness, anger, anxiety, worrying about the baby's health, and if the mom is taking care of is doing a good job of being a parent. There's also difficulty in taking care of self and the baby, and in extreme cases the mom starts thinking of harming herself or harming the baby. Women who lack support or women who have had depression before are at an increased risk of having postpartum depression. Something else that accelerates postpartum depression are lack of enough sleep and the physical discomfort. I mean, all in all, postpartum depression can happen to anyone. So, yeah, new moms need a lot of support from family, friends, and yeah. The other type of depression is situational depression, and this type of depression is depression that happens, rather that occurs after certain events, like the loss of a loved one. Someone could be having legal battles, they could be going through divorce, they could be going through child custody cases, they could be having financial problems, they could have lost their job, they could have lost a friendship, they could have they could be in an emotionally or physically abusive relationship. And what else? Yeah, life threatening illnesses, or of course illnesses are life threatening. What else? There are, if one is having a serious or a terminal illness. Some of the symptoms that come with this type of depression are crying frequently, sadness, hopelessness, changes in appetite, loss of appetite or increased appetite, pains and aches. Uh, Someone can be fatigued and general loss of energy, loss of concentration, and social withdrawal. I mean, when someone is rather most people, when they're depressed, they just want to keep to themselves. Other type of depression is premenstrual dysphoric disorder. Well, this is a severe case of PMS. We already know PMS is premenstrual syndrome. With PMS, most women are more emotional than than they are on normal days. But with PMDD, they literally experience depression symptoms, as in they are sad. In some cases, someone starts having suicidal thoughts. So PMDD can be quite serious, and it should be taken seriously. So PMDD can be termed as a chronic illness, which means it needs treatment. I mean, it's a type of a mental illness, and well, it needs treatment. Some of the approaches that can be used to treat it or reduce the severity of the symptoms are, of course, there are regular exercises, increase your intake of proteins and carbohydrates, and reduce your intake of alcohol, sugar, salt, caffeine, and yeah, those three. There is stress management. You can take birth control pills, which means you need to contact rather to see your gynecologist and see your therapist. The last approach of treating PMDD is the intake of SSRIs, which mean selective serotonin reactive inhibitors, which are mood stabilizers, but they can only be prescribed by a psychiatrist or a psychologist. So yeah, you cannot just go and get them over the counter.